Good morning. If we could have everyone come around to the front here, we can go ahead and get started. First of all, I want to again welcome all of you here to this wonderful new facility. My name is Paul Lorenz. I'm the Chief Executive Officer for Santa Clara Valley Healthcare. As most of you know, the healthcare system in Santa Clara County is really focused on building community health, protecting and promoting the health of our entire community. And so we're here today to talk about a brand new facility for the healthcare system that is going to serve this community and really focus on promoting health, which I think all of us understand the importance of. You know, the concept of community health comes from the fact that we come together to ensure that everyone has access. There's one individual that I'll be introducing on the Board of Supervisors, Supervisor Joe Simitian, who has been a staunch advocate to ensure that we as a healthcare system go out into the community and serve the community in their best interest. And so fortunately, we have today, through his good work, the ability to present to this community this health center. Supervisor Joe Simitian is the chair of our Health and Hospital Committee, and as you well know, serves District 5. So at this time, I'd like to introduce Supervisor Joe Simitian.
Thank you. Paul is not only an extraordinary healthcare provider, he's an extraordinary diplomat. He says I have been a staunch advocate. That's code for I have been a constant pain in the neck, just to get our terms right. And I can't tell you how happy I am to be here. So let me say good morning and thank you to all of you, and to you in particular, Paul. And we obviously have a number of community leaders, folks from the elected official world and the nonprofit world and the healthcare world, and I do want to thank you very personally and particularly for being here. And I can't help but turn to folks from the county who are here and observe that in this North County area that I represent, along with a big chunk of the West Valley these days, Palo Alto, Mountain View, Los Altos Hills, there are elected officials here today from all four of these communities. And they're here for a reason. They're here because they understand the need. They hear from their constituents just as I hear from my constituents, and they are our common constituents, the nature and extent of the need. So I hope that folks take note of the presence of the electeds who are here from all four of the communities I just referenced. I know I saw Palo Alto Mayor Pat Burt, and I saw Vice Mayor Lydia Koo, there you are, and I saw Mountain View Councilmember Margaret Abe-Koga right there in front of me, along with Lynette Lee Eng from Los Altos, thank you, council member, and I'm pretty sure I saw Los Altos School District Jessica Spicer, where are you? There you are, right there in front of me, along with Shelly Sorkay, who's right here with us as well from Los Altos School District, and from our high school district, Mountain View Los Altos High School District, Trustee Catherine Vonnegut. Catherine, thank you for being here. And, you know, it's not just the electeds, and forgive me if I overlooked an elected along the way. Oh, there you are, right there in front of me. Ellen Wheeler from Mountain View Westman, and Sanjay Dave from the district as well, the school district. It's our health club. And, you know, I started my public service career on the Palo Alto School Board, which I like to say is the toughest job in elected office. I would really be remiss if I didn't call out our local school board member, and that is Jennifer D Branson. Thank you for being here, Jennifer, and for understanding that if we care about kids, we got to care about kids in their entirety, their totality, and that means healthcare as well as education, obviously. From Ravenswood Healthcare, their CEO, Luisa Buada, who is our partner in all good work. Luisa, raise your hand again. That was a little shy. Thank you. Some of you will know, but not all of you will, that Ravenswood stepped up when Mayor you is struggling, to make sure that we continue to have affordable, accessible health care here in the absence of a county clinic, which I will talk about a little bit more in a moment. CSA's Executive Director Tom Myers is here. Thank you, Tom, for being here. Somebody else who provides real sort of in the trenches, on the front line service. I know Maria Marroquin was going to try and be here. There you are, back. Thank you from our Day Worker Center. And Philip Da was from Life Moves. Thank you for being with us again, Philip. And Jen Torrey from Stanford Healthcare. Jen is not able to join us today. All right, but we have with us John Cowan from El Camino. El Camino is, again, another one of our great partners. And Olga Mello, who is the president of the Mountain View Community Action Team. There's Olga. There you are, right there in front of me. And Mary Lou Cuesta. Oh, Mary Lou, give us a little more than that. Come on. Go ahead. Mary Lou is one of our promotores in the Mountain View Community Action Team, and that is an incredibly important role in making sure that we take the good services that are available and connect them to the people who really need the help. Now, what Paul was very graciously referring to is the fact that over the last 10 years, I have been advocating for more county health services here in the North County. And I think we have to take satisfaction in the fact we've made real progress on a number of fronts. And it's been incremental, so it may not have been something that folks sort of saw in a big and dramatic way. But over the course of these last several years, we've now got the Specialty Healthcare Clinic over on California Street, right next to our friends at Planned Parenthood in Mountain View. We've got the county pharmacy in the same place. We've got the dental clinic on El Camino Real, because dental health is part of the complete package, also in Mountain View. And of course, just down the road here on Middlefield, here in Palo Alto, we've got the first of its kind mental health resource, Alcove, helping to serve young people. Thank you. Thank you to everybody who made that possible. All good, all really good stuff. But what we haven't done yet, is brought a full-service county health clinic to this part of the county. And so some while ago, I asked my team for a map because some of us are visual learners. And looking at that map, you could quickly tell, and I don't have a blow-up here for you, so not to worry, and there's not a pop quiz later, but there are 5 numbered districts in our county. And in looking at the map showing our county's health and hospital clinics, you can quickly realize that there are more than a dozen, actually 3 hospitals and probably 10 full-service clinics, none of which are located in District 5. I want to say that again. 13 hospitals and health clinics in this county, none of which are located in District 5, where we have 400,000 residents, District 5 residents in 9 different cities that I am privileged to represent. Now, I know that the leadership of our health and hospital system knows that. They knew it anyway, and they definitely know it after hearing me talk about it at meeting after meeting after meeting over the course of these past many years. But as I say, the real concern is that while there are 3 or 4 clinics and hospitals in every one of the other 4 supervisorial districts, and I am glad for that, just to be clear, that has meant historically that District 5 residents in these 9 cities, as I say, roughly 400,000 county residents, have never had a hospital or a clinic to call their own until today. For the first time in our county's 172-year history, folks in need of affordable health care will be able to get that care at a county facility when they need it, where they need it, right here in the North County. This building, this community space right here on the border of Palo Alto and Mountain View, and for my Mountain View and Palo Alto council members, we worked as hard as we could to get right between the 2 communities so that everybody felt this place was theirs. Right down San Antonio from Los Altos and Los Altos Hills so that people felt that this was their community health center. And this will become the first ever Valley Health Center for the North County area. 2.5 years ago, it was my privilege as board chair at the time, board president at the time, to give a State of the County address, just like the mayors give the State of the City address. And I made the judgment that I wanted my comments to be exclusively devoted to healthcare, because I thought it was just that important. And at that time, 2.5 years ago, I specifically called out the need for a clinic here in the North County, in District 5. And, frankly, most of these kinds of State of the County, State of the City, State of the Nation remarks are kind of a once-over lightly, and I think folks don't always understand that they really do represent an opportunity for those of us in public office to say, I'm laying down a marker here. This is important. It matters to my community. And over the intervening 2.5 years, we've had the conversations that were necessary. The organization has certainly understood that there is a need and a demand, and that there is an economic viability to a clinic in this location. It was, I think, maybe a year ago that at my request, my board colleagues asked or directed administration to provide some options for the creation of a Valley Health Center here in the North County. I want to say thank you to my colleagues for their support. All the electeds know that without 3 votes or 4 votes, depending on the body, all you've got is a good idea. And this coming Tuesday, this is the reason for today's announcement, this coming Tuesday on our board agenda, the board will have the opportunity to approve the acquisition of this site on a long-term lease with an option to buy. And my hope is that this site serves my constituents in person. If that was too subtle, I'll try it again some other time. Wanted to make sure I laid down that marker. I should say, before we bring up the next speaker, I do sometimes hear folks say that, gee, it's a pretty prosperous area. Do you really need a facility like this? And I see the folks here who are in this world nodding their heads, because they know that our prosperity is not uniform. It is not that this facility will serve. We have more than 90,000 residents who are below that level, almost a quarter of the population. And these are the families who are trying to make ends meet. They're trying to hang on. They're trying to hang in. They're struggling to stay in the community, a costly place to live. As they try to hang on, they often sacrifice some of their basic needs. They're making those decisions about pay the rent, put food on the table, to forego the health care that my family and I really need and deserve. And so, with our partners, many of whom are here today, we will be part of the solution for those families. So thank you to all of you who are doing that work today. But how about a round of applause for all the work you're going to do in the years to come to make this happen. Now, I think all of you in the public arena and the social service arena know that the need has only gotten greater in these past few years. And it has created capacity challenges for, I think, public and private and nonprofit institutions. It certainly puts pressure on existing county clinics in neighboring communities. So, as I am making the case for this facility with my colleagues, I point out to them that yes, obviously opening a clinic in the North County will make healthcare services more accessible to North County residents, but it does more than that, because it will also take pressure off our overburdened Valley Health Center in Sunnyvale, reducing those far too long wait times that people are currently experiencing. If folks in Sunnyvale can't get an appointment for weeks and weeks or even months, then that's a problem for them. This facility here in the border between Palo Alto and Mountain will help solve. It also means that our community health partners, again, I want to call out Ravenswood, and I mean call out in the best of possible ways. I want to call out Ravenswood and Planned Parenthood. They won't have to shoulder the burden all by themselves anymore, because this kind of clinic can supplement their efforts, can provide care that complements the good work they will continue to do. And what I've been proud of, and it's a constant struggle, is that we work very hard to make sure that we're working in tandem, that the work we do in our county facilities supplements and complements the work of our community clinics, does not compete with them. We're not competitors, we're partners, we're collaborators, and we need to realize that as we do the work in the years to come. So for me, this is a very exciting day. If you look over my shoulder, this is a little visioning exercise, everybody. If you look over my shoulder, what you see is an attractive but empty office building. What I want you to see, and you will soon see, is a place of healing, health, of hope, and well-being. That is the vision for this particular site. And I want to thank everybody who made that vision real. We'll continue to work to make that vision real in the months and years ahead. We have a building, as I say, that's incredibly important to start, 24,512 square feet. Is that, yep, I see the heads nodding. Not that I've been counting one by one, but I've been pretty attentive to making sure that we have the 20,000 to 30,000 square feet that we need. It's in an ideal location, but it will take work to turn it into a 21st century facility. And those of you who've worked with me know I'm constantly saying we need to do more and we need to do it faster. So I'm going to say it again today. We need to do more and we need to do it faster. But I look forward to welcoming you all back here for the ribbon cutting. No pressure. The ribbon cutting in 2024, because there is some work to do here. And celebrating then healthcare for all, healthcare that is accessible, affordable, and high quality. We are what's known as an FQHC. For those of you not hip to the lingo in the healthcare world, that means we're a federally qualified health center that is in a position to offer a comprehensive range of services. Families will be able to take advantage of the county's many resources, resources that go well beyond primary care, and allow us, as I say, to partner with our colleagues. To tell us a little bit more about that, I'm very pleased to have Dr. Angela Suarez, medical director of our primary care clinics, here today to share a little bit more about what this new North County Valley Health Center will mean and will provide for the residents of our area. Please join me in welcoming Dr. Angela Suarez to the day. Thank you.
Hi, good morning. I'm happy to be here today to introduce our new Valley Health Center in North County. Just like our other health centers across the county, this Valley Health Center will operate as a patient-centered medical home operating full-service care. It will primarily be a full-scope family medicine practice offering care for OB, pediatrics, adult medicine, with ancillary services including pharmacy, laboratory, and diagnostic imaging. We're very excited to be bringing mammogram services and
I don't want them to miss a word.
Okay, thank you. We're very excited to be bringing mammogram services and an all-ages urgent care to North County, which means that our patients will no longer have to travel to other clinics or one of our 3 public hospitals for many of their care needs. Also, supporting this practice will be diabetes education, behavioral health, medical social services, and perinatal services. The convenience of having so many services together in one location, close to home or work, means healthcare when and where it is needed for many of our North County patients. Santa Clara County is rich in ethnic diversity, which includes both its residents and county workforce. Our multilingual and cultural staff will provide a setting that makes patients feel welcome, as in our other Valley Health Centers. Understanding the patient's background and ability to communicate in their language makes it easier to explain to them why preventative screenings, though sometimes time-consuming, are so important to their health. It also allows them to communicate their needs and puts them at the center of their care team. The County of Santa Clara system has made health equity a priority, and one step in that process is to collaborate with other healthcare and community organizations. By working together, we will be able to provide better health for all. This new Valley Health Center will ensure that everyone who lives or works in the community has convenient access to quality health care, whether that be preventative screening, urgent needs, or chronic medical care. Thank you.
Thank you, Dr. Suarez. And, you know, I realize I'm standing here and I'm looking right at Lisa Schmidt from the Los Altos Hills Town Council, who said hi when I walked in. So I want to ask you to join me in thanking her for representing her community here as well. And Lisa, I'm hoping that there'll be ophthalmological and optometric services in the facility when the time comes. It's right here in front of me. Do we have questions from anyone, either from the press or from the community? We want to try and include everybody. By the way, don't we have somebody from Community Health Partnerships that I... Oh, yes, thank you for being with us. These are the folks who really are our partners in public health, so thank you for being here. Sorry to neglect you earlier. Questions, if any, for Dr. Suarez or Mr. Lorenz? Yes, Ellen.
What's the difference between this facility and the one that you just invited us to a couple weeks ago?
The question, and I'm going to ask both Paul and Dr. Suarez to come up. The question from Ellen Willer was, what's the difference between this facility and the one that we were visiting at just a few weeks ago to talk about our medicines program? I'm going to give the glib answer, which is about 25,000 square feet. Because that is a very modest space where we're doing good work and have a real nice partnership with Planned Parenthood, but obviously it's a small space. It's not a full-service clinic. But why don't I let Paul and Dr. Suarez tell you a little bit more about what will be here versus what we can do there.
The clinic at 2500 California is a specialty care clinic with pharmacy. This is going to be a full-scope family medicine primary care clinic that will also offer urgent care services.
Other questions, if any? Yes, Louisa.
So the biggest need that we encounter is access to specialty services, and the California clinic has 2 exam rooms. So we're wondering how much specialty is coming here. Because right now people have to drive all the way down to San Jose for most of them, and then those services that are not offered at BMC, sometimes they send to Livermore, Gilroy, Milpitas, for specialty. So are you going to have specialty services here more significantly?
For those of you who couldn't hear over the traffic, that was our friend Louisa lobbying in the guise of a question. And I mean that in the best possible way, because what she is highlighting is the importance of our county providing the specialty care that really does add to, supplements, complements the work that our community health partners are able to provide. And as Louisa was pointing out, since I have the microphone, I want to amplify your comment / question. Louisa was pointing out, absent those services, these are folks who will need to get to not just San Jose in some instances, but all the way to the other end of the town. And what that means is, not only is there a cost and an inconvenience, but too often it means people just don't get to the care that they need. So in terms of the specialty care array of services that we anticipate, I'm going to turn again to Paul and Dr. Suarez, but I did want to make sure people heard the question / comment, because it is part of what has been making me so determined to see if we can't get a facility here in the North County for the first time in 172 years. Paul?
So yes, our plan is to rotate some specialists through this clinic. Space is a big consideration, and we want to make sure that we're offering all of the services that are needed to support the primary care, but our plan is to rotate certain specialists through this clinic, just like we plan to rotate them through 2500 California.
And I would also add that, as Supervisor Simitian has mentioned, our partnership with Community Health Partnership and the other community-based organizations is critical. So as this clinic evolves, we would definitely provide for specialty services, as Dr. Suarez has mentioned, and that as the need dictates, we'll start to increase those services and make those available so that we reduce the wait times.
And I am determined to simplify, perhaps oversimplify some of this. When we talk about rotating the specialties, what that means is that we can do literally twice as much. We can provide a array of services that is twice as great if we rotate the folks who can be accessible here at this clinic to the community, so that on Monday, Wednesday, and Friday there's one set of services in the space. On Tuesday and Thursday there's a different set of services in that same space, and that's how with 24,512 square feet, we absolutely maximize the range of services that are available for the folks we serve. Anyone else before we all go back to making the world a better place? Yes?
Hi, I'm Liz from the Palo Alto Weekly, and I had a question about the anticipated cost and how many people it expects to serve.
All right, I'm going to turn it back over to Paul and to Dr. Suarez to talk about cost. And I can just warn you that we have what we call an enclosure in our board packet for Tuesday, this coming Tuesday's meeting, that lays out all of the cost figures in great detail. And I say in great detail because you aren't going to want Paul to walk you through the annual lease costs year by year and then the criteria for eventual acquisition should that option be exercised. But Paul, what's the short version on cost?
So at this time, we're looking at about a $20 million tenant improvement. And then our monthly lease cost is a little bit over $1 million per month. I would also add that as we go through this project, one of the important things for us to realize that this is a federally qualified health center. So the reimbursement for the services that we offer are a level in which we can not only sustain the services here, but grow services for the community.
Really, maybe more than you or anyone else here ever wanted to know, but that last piece about being a federally qualified health center is essential to our ability to make this work, because that means that we have a reimbursement rate that will pay for the services, including the cost of this facility in the years to come. This was one of the things that was such a struggle for our friends at Mayview. They simply didn't qualify for the same reimbursement rates that our county qualifies for, and that's why we so appreciate the fact that Ravenswood was able to step up and become a parent in effect. But absent that federally qualified health center status, the reimbursement rates don't always get us to the place we want to go. And over here, we had a question from.
Just a correction, your numbers was $1 million a year, not a month.
So, yeah, thank you for that. He's the building owner, by the way.
As much as I would want it to be a month.
Thank you. Slip of the tongue. All right. Any other questions? Going once? Going twice? Oh, yes, Maria.
Yeah, well, thank you so much and congratulations to all of us just to have this big milestone. So regarding the people who is already taking care in the Valley Medical Center, so they are able to choose where they want to be treated after this is open or not?
Well,
Yes, individuals can choose where they access care. Obviously, they can come here. We'll be partnering with our community health partnership clinics, so if they choose to go to another clinic that's more convenient, they will have those options.
Thank you.
and Catherine and then Shaw. And then let's wrap it up because I know people have lives to get on with and good work to do.
This is not for your first phase, but at some point will mental health services be added?
Question was, will at some point mental health services be added? And I'm going to turn and get a nodding head confirmation when I give the short answer that is yes. Okay? And Catherine, now I'll take your question and use it as an opportunity for a further statement. And the reason for that is because mental health care is health care, which I know you know, and that's what prompted your question. Shali, you get the last question / word.
We have so many great community organizations offering social services in Simitian. Is there going to be a linkage between this clinic and referring out to some of those social services?
Question has to do with the ability of this facility to provide the linkages, liaison, relationships with social service agencies and some groups here in the area. Paul, Dr. Suarez, I think what you're getting is a nodding head. Yes, that will be part of our work. And probably shouldn't say this, but I have yet another site in mind, so stay tuned. Okay? More to come. Thank you all for being here. Thank you for all the good work you do to make this possible. And we'll see you at the ribbon cutting someday soon, I hope. All right? Thank you.